Hi all, this is Ramya from Takeju Master near MOSC Medical College, Kolancheri. Hope you all are fine and safe. So we can start our video, start our class. So today in this class we are going to discuss about the type of sentences that you can use while you are writing an OET letter. Okay, so the type of sentences and the collocations, medical collocations are also quite important. So we are going to discuss about these two things in this video. So first, we can see what are the type of sentences which you can use when you are writing about an admission diagnosis. Okay, so there are different types of conditions. In the case note, the patient will be presented with the different conditions, and the patient will be presented with different concerns or symptoms or something like that. Okay, so when the patient, when you are writing about that, that can be the first body paragraph. The sentence can be starting. This type of sentence can be used to start the first body paragraph. Okay, so here you can see some sentences written over there. So these are the sentences which you can use. I'm not saying that these are the only sentences. You can use according to your language ability. Okay, so here these are some sentences. Mr. Samuel was admitted to a hospital 3 days ago for a thyroid gland removal. Okay, so here the patient was admitted to a hospital 3 days ago. Okay, 3 days ago for what? For a particular procedure. Okay, so whenever there is a whenever you are going to write a letter related to some procedure, you can go for writing the sentence. Next sentences, Mr. Samuel was admitted to a hospital on June 2021 with the complaints of. Okay, so here you can see that with the complaints of. So this particular patient was admitted there with some complaints. Okay, whenever you are going to write about the complaints, you can write the sentence. Okay, again on next sentence you can see on 1 June 2012, comma. So whenever you have your writing date, you need to put comma. So I have missed comma here. Okay, on this sentence I have missed a comma. That is my mistake. I'm sorry for that. Yeah, on 1 June 2012, Mr. X was admitted to a hospital with a concern. So this particular patient is admitting there. So he has some concerns. Okay, so he has some doubts. So with that, he is presenting there. Okay, so when similar case notes come, you can use the sentence. Again, you can see another thing, it's like multiple visits. So when you're having multiple visits, so some case notes you can see there are different dates written there. Okay, so in such cases you can write like initial visit is quite important. The later visits depends upon what all things happens in that one. Okay, happens during this visits. So here in initial visit you can write like initially, comma, Mr. X presented to our clinic on 1 June 2010 with the concern regarding constipation. Okay, so this particular patient was presented there. Okay, not was presented there with a particular concern regarding this patient's constipation. So that is the initial visit. So when you are writing about initial visits, you can go for writing this. Now we can see about this type of sentences which you can use when you are writing nursing management. Okay, when you are writing nursing management, you can go for writing these types of sentences. Just see, an X-ray. Usually when some events that happens in the hospital, whenever some events that happen in the hospital, it's always better to go for writing in passive voice. Okay, rather than writing in active voice, it's always better to go for writing passive voice. So sentence formation and the type of sentences I have explained in the last video about the compound complex sentences. As you know that in order to get a good score in OET writing subtest, it's mandatory to write different types of sentences. Okay, like compound sentence should be there, complex sentence should be there, passive voices should be used accordingly. Okay, when you are using a passive voice, that when you are writing in this OET letter, especially when you are writing about this events that happen, so the medicines which you have given, you have to use passive voice. When you are using this passive voice, the other person will understand that how good you are in that language. Okay, how good you can understand which is important, is the patient or the thing that happened there, or the medicine is important. Okay, so for that you will be writing with active and passive voices. Okay, so now we can move on with our video. So here you can see that different types of nursing management sentences has been written there. Okay, so here an X-ray, whenever an event happened in the hospital, it's always better to go for writing in passive voice. That means an X-ray should come first. Okay, so here an X-ray was done which revealed a fracture in the left tunic of femur. Okay, next sentence, certain blood tests were ordered. So there also blood test is more important. So you have to focus on that one and make it passive. Okay, next one, case notes can be combined together and make a single sentence. That is also something which you need to take into account. Okay, some the informations will be spread in the case note, isn't it? So you need to collect it, you have to bring it together, and you have to write it. Okay, so that is what is known as conciseness and clarity. Okay, that is one of the criteria which has been valued. So for that, how you can combine these sentences. Some examples are given there. As she exhibited signs and symptoms of pneumonia, comma, she was treated with a chest physiotherapy. These informations will be spread in the case notes. So I have taken it together and have make a single sentence. Okay, so in this way you need to take information from different which is spread in the case note, has to be taken together, and you need to make a single sentence. Okay, another thing, he has increased gastric reflux and jaundice, comma, for which phototherapy was provided for 3 days. Okay, so these sentences formation, just see how the sentence formation has been made. Okay, so compound sentence and complex sentence has been used here. Next one is, his wound is healing well with the regular dressing changes. That was also some when you get the case note, you can understand that wound is healing well will be getting from some place else, and the regular dressing changes will be you will get from somewhere else. Okay, so this has to be combined together and should make a single sentence. Okay, his wound is healing well with regular dressing. Now another sentence is like, he was prescribed paracetamol for pain relief. There also you have to see that he was prescribed paracetamol for what? For pain relief. Okay, so these are the sentences. These are some of the sentences which you can use when you are writing about nursing management. Okay, now we can see the sentences which you can use while writing nursing progress. Okay, so nursing progress. Okay, when you are going to write about the nursing progress, you can write like, if it is an operation, if it was surgery which happened in the hospital for this patient, you can go for writing post-operative period is quite important, so you have to include that one. So you can write like, post-operatively his condition progressed well. Okay, another thing is like, despite of the intensive care, his condition deteriorated. Okay, so we are going to say two different things. Okay, despite of the intensive care, so we have provided him intensive care, but still the patient's condition deteriorated. So in such situations, how you can write the sentence formation can be made like this one. Okay, another thing, although he can walk with a pick-up frame, comma, he still requires assistance for daily living. That is a passive voice. Okay, so we are going to say two different things or two opposite things. Okay, although he can walk with POF, okay, pick-up frame, but what is the problem? He requires assistance for daily living. So you have to combine it together and you have to make it a single sentence by you using a passive voice. Okay, so this is it. And last one is like, currently he made a good progress and can ambulate short distance. Okay, so here the sentence is like, currently he made a good progress and can ambulate short distances. Okay, so I hope that is also clear. Now we can see the sentences which you can use when you are writing social history. Okay, so social history. So social history, most probably you will be writing about those habits, okay, habits of alcohol, smoking, and even some weight, okay, related to weight also you will be writing. Okay, so how you can write when you are writing a social history about alcohol? You should not use any, it is mandatory, like you should not use any judgmental languages. You have to write what is given on the case note. Okay, that is quite important. So when it is alcohol, see the sentences over there is, alcohol intake is higher than the recommended level. It's better to write in that way rather than writing like he is a alcoholic or he is a drinker. That all are judgmental. So it's always better to avoid judgmental languages. So you can write like, his alcohol intake is higher than the recommended level. These are some sentences which you really want when you're writing a letter. Okay, next one is like, like he consumes 4 to 5 units of alcohol daily. If this particular information is given in the case note, then you need to write it as such. You have to write how many units of alcohol. That is important, and you have to include that one. Okay, he consumes 4 to 5 units of alcohol daily. Next one, he has a habit of consuming alcohol for the past 10 years. So he is having a habit, and he is taking this one for the past 10 years. So if such information is given there, if the time period is also mentioned there, you can go for writing this particular sentence. Next one is like he was advised to reduce his alcohol consumption. If this information is given in the case note, like if the advice is given regarding his alcohol consumption, you have to write in this way. Okay. Now about smoking. He smokes in excess. That's quite a judgmental language. That's not a very good sentence. You can avoid that type of sentences. It's better to go for writing he smokes 10 cigarettes per day. That means definitely he smokes in excess, but better give a clarity. He smokes 10 cigarettes a day. Next one, he has a habit of smoking and consuming alcohol for the past 20 years. Okay, there also these information has been given. The time period may be given. In such cases, better go for writing that. Again, if this in such cases, like if the age is given from when he started smoking, go for writing this way. He has been smoking since his 18 years of age. Okay, so I hope that is also clear. So now we can see about weight. When weight is being set, he has a high BMI of 33. So if the BMI is given, go for writing BMI, and if the height and weight is given, go for writing that one. You don't want to calculate BMI. Okay. Another way of writing is his weight is higher than his ideal weight range. Okay. Another sentence is it has a weight of 80 kg with 170 centimeter height. Okay, so if this information is there on the case note, it's better to go for writing this particular thing rather than calculating the BMI. Okay, now we can see about how to write medical history. Okay, how to write medical history. So usually we'll be having conditions like diabetes and hypertension, isn't it? So medical history means definitely most case notes we can see this diabetes and hypertension. So how to write this diabetes and hypertension? She has a history of hypertension and diabetes since 2000 and 2004 respectively. If this 2 years is given, okay, for hypertension and diabetes, if the 2 years are given, you can go for writing this one. Okay, so since 2000 and 2004, and you have to write respectively. Okay, at the end you need to write respectively. Next one is Mr. Baker has type 2 diabetics for which metformin is prescribed. So here some medicine is also been in the case note. It is given the medicine which he is taking for diabetes. So you can go for writing that too. Next one, she has had hypertension since 2011. Okay, next one is her hypertension is controlled by tablet bisoprolol. Okay, so in these ways you can write sentence, or you can form sentence when you are writing these kind of things. Okay, now we can see about the recommendation paragraph. Okay. So I have to say that it's better not to use phrases such as in conclusion, in summary, overall. These all types are academic, and usually we will be writing when we are writing IELTS. Okay, so here in OET letter, we don't want to use these kind of sentences or phrases. Okay, here it's always better to go for writing. It would be appreciated if you could ensure. So if you want to ensure about exercise program or healthy diet, especially when you're writing to a physiotherapist or a dietitian, you could have used this phrase. Okay, if you could ensure his exercise program and his ensure to follow a healthy diet, something like that can be written. Next sentence is like, I would appreciate if you could monitor her pain status for which Panadol can be administered. Okay, these type of sentence can also be used. Another one is, it would be beneficial if you could educate her regarding the importance of following a healthy diet. If the patient is having some weight related program or diabetes or something like that, you can conclude your letter while using this particular sentence. Okay. Next one, it is requested that an abdominal CT scan can be taken for an accurate diagnosis. So maybe during the next follow-up visit, she is requested to take a CT scan. So if such situation is there in the case note, you can go for write this one. And again, another sentence. This is you don't want to write this particular sentence in every letter. Sometimes if you're writing to a doctor and he requires, this particular patient requires an emergency or urgent evaluation, you can write the sentence, your role is indispensable for her better recovery. Okay, if you're writing to a professional, especially to a doctor, you can go for writing this sentence. So I hope that is also clear. Okay, so now the next thing is about the importance of using correct medical collocations. That is quite important when you are writing an OET. So in simple words, collocations can be defined as words that come in pairs. Okay, so these are the words that often go together. You shall not separate them. It's always better not to separate them. Okay, they do not look good when you replace this particular word with another word. Okay, for example, I can say like if the patient is having a bad headache. Okay, so in the case note it has been written like a bad headache. So that is really a very common type of phrases that has been seen in the case note. Okay, the patient has a bad headache. So you cannot okay, for example, if for this bad headache, if you are using some words like awful headache or annoying headache, I don't think that usage is good, and that is better. Okay, it's always better to write there are some collocations which you need to follow, like what is given in the case note itself. Okay, so again, another type of sentence may be given in the like on the screen. You can see things like discharge from hospital. Okay, so these things can be used like that itself. These are some medical collocations which you can use as such. Okay, so he is discharged from the hospital. Okay, so these types of collocations can be used as such. When if that is there in the case note, it's better to go for writing like that itself. Admitted to, that is a phrase which go together. Admitted to, the patient was admitted to this particular institution, particular hospital, to the what a hospital name can be given. Okay, then another thing is like associated with. Okay, so associated with is also a phrase which always go together. Okay, you can see the example. Mr. X presented with the complaints of shortness of breath, which was worse when lying down. So it was associated with the tightness in the chest and coughing. So this particular thing is associated with some other things. Okay, so in such cases you can go for using the collocation associated with. Another thing is like these are only few examples. There are a lot other examples. Okay, allergic to, please note he is allergic to egg, nuts, penicillin, something like that. Okay, so yeah, that is it. So I hope you understand the video, and if you think that this video is useful, kindly subscribe my channel, and thank you for watching. Thank you so much.